Hi everyone, today we are going to see types of impression in complete denture. Let's go into the introduction. Actually, impression is nothing but a imprint or negative likeness of teeth and edentulous area where the teeth have been removed and which is made of a plastic material which becomes very hard while contact with the tissues. Complete denture impression is defined as a negative registration of entire denture bearing areas stabilizing border seal areas present in the edentulous mouth. Let's go into the classification. There are of various types. First one we go into the depending on theories. There are three: mucostatic, muco-compressive, selective pressure. The next one is depending on the technique. There are two: open mouth technique, closed mouth technique. The third one is hand manipulation. In this hand manipulation, border molding is involved. The next one is depending on the type of tray. The type of tray, two types are involved: custom tray, stock tray. And the next one is depending on the purpose of impression. There are three: diagnostic, primary, secondary. The next one is depending on the material used: reversible hydrochloride, irreversible hydrochloride, modeling plastic impression, plaster impression, wax impression, silicone impression, and final one, thiocol rubber impression. Let's go one by one. First we go into the depending on the material, that is depending on the theory. First one is mucostatic impression. It is also referred as passive impression. The first mucostatic impression is proposed by Richardson and later by Henry. They are made with oral mucous membrane and jaw in a normal relaxed condition. In this impression, oversized tray should be used. Impression material like impression compound and many other impression materials can be used. Mainly here, retention is due to interfacial surface tension. Advantages is good stability and disadvantages is poor retention. The next one is muco-compressive impression. Muco-compressive impression is discovered by Carole Jones. It records the oral tissues in the functional and displaced form. Materials used are impression compound, wax, and soft liners. They can be displaced due to tissue rebound at rest. While functioning, constant pressure is applied on the soft tissue so that they limit the blood circulation. It finally leads to the residual ridge resorption. These are the common complications of mucocompressive impression. The next one is selective pressure technique. In this one, impression is this is a common one involved in various impression techniques. There is a selective pressure technique. In this one, mainly impression is extended till the denture bearing areas without interfering the limiting structures at the function and rest. Force is applied on the denture to the stress bearing areas. They are achieved by designing the special tray. Non-stress bearing areas are relieved and stress bearing areas are come in contact with the tray while giving the pressure on the area which is confined to the stress bearing areas, and relief of area can be given with wax. The next one is depending on the technique. There are two: open mouth technique, closed mouth technique. First one, open mouth technique. It includes the impression technique which records the tissues in the undisplaced position. Pressure or pressureless technique can be involved here. Next one is closed mouth technique. Only in the functional method can be involved. They are used blocks are used instead of impression trays. Lined with impression material, swallowing, grinning, and pursuing lips are performed to maintain the closed mouth technique. The next one, hand manipulators, also referred as dynamic impression. Border molding is used in the CD fabrication. Border molding is nothing but the shaping of borders of impression trays to conform accurately to the vestibular areas and border seal areas. There are two movements: passive movements and active movements. In the passive movements, lips and cheeks are involved to obtain functional impression, and the active movement are opening and closing can be obtained to record the areas of impression. The next one is depending on the purpose. There are three: diagnostic, primary, secondary. Diagnostic impression is mainly for diagnostic cast preparation. Therefore, purpose to survey the undercuts and also estimating the amount of prosthetic surgery. Mainly, diagnostic impression is used to establish occlusal balance. Primary impression, also known as preliminary impression. Impression is made for the purpose of diagnosis or for the construction of tray. First step is taking impression, and also next one is fabricating with stock tray. The tray selection factors are involved. 3 points are there. First one, 5 mm clearance should be there between the stock tray and ridge. The next one, posterior area should still extend till the tuberosity and mammary nuts, and mandibular portion it should still extend till the retromolar area. The next one is if the tray is deficient, wax should be utility wax is added. And the primary impression is made with impression compound, alginate, or impression plaster. The next one is secondary impression. It is also known as wash impression. It is for preparing the master cast. It records mainly the denture bearing areas and peripheral seal areas. Custom tray or special tray can be involved here. 2 mm short, border molding is involved, movement should be given, and impression material should be of low viscosity so that they get involved in the uniform and thin layer. Materials used are zinc oxide usinol, medium body elastomeric impression material. The next one is depending on the material, that is reversible hydrochloride. Reversible hydrochloride agar can be used. First, we agar taken from the tempering section at 46 degrees Celsius and loaded in the water cooled rock tray. Disadvantage is poor dimensional stability and also elastic one as undercuts. Next one is irreversible hydrochloride. Here alginate can be used. Alginate is mixed with the water in the form of homogeneous mix. They are mainly better for peripheral seal areas. Advantage is good economical and disadvantage is poor stability. The next one, modeling plastic impression. In this one, impression compound is used. They are softened in the water bath at 64 degrees Celsius and kneaded till the uniform mass is obtained. Stock tray can be used. Their advantages are low cost and easy for use. Good dimensional stability. Disadvantages viscosity, high viscosity so that they can displace surface tissue and not records accurately. The next one is plaster impression. In the plaster impression, type 1 plaster is used and also mixed with water in the equal ratio. In the plaster impression, potato scratch form like can be seen here. It is mainly used for easy of separation cast from the impression. Disadvantages, patient is discomfort and poor handling properties. The next one is a silicon impression. They are classified into the condensation and addition polymerizing silicon. In the condensation silicon, it available as reactor and activator paste. The disadvantage is dimensional instability. Addition polymerizing silicon, it also available as tubes and cartridges. In the tubes, same as a condensation technique, but in the cartridge it is dispensed in the dispenser gums and also available in putty form. The final one is thiocol rubber impression. Thiocol rubber impression, polysulfide impression material can be used. They are also available as base and accelerator paste. It is similar to the elastomeric one, used for mainly silica secondary impression. Thank you for watching.